Today we're talking about hey Mario, hey, you and I decided to call the podcast what, Mario? Chiropractors Exposed. Today is the Chiropractic Expose, right? Talking about
we're exposing the pain,
the differences between chiropractic and the design, and we're going to be getting funky and deep with the technology and the knowledge.
It's kind of scary. I'm just going to tell you right now, if you don't have your seatbelts on, strap in.
Mario, today we're going to be talking about, we decided to come up with a large component of our practice is personal injury. Personal injury is a type of practice where we deal with people that are injured from all different sorts of issues, such as falls, slips, accidents, any nature, workers' compensation, auto accidents. A lot of things happen when you're in a personal injury dynamics. But being a doctor that deals with soft tissue issues, Mario and I have been doing this now for nearly, for myself, almost 32 years. And Mario, you've been doing about 26 years almost now, right? So we've been doing it for a long time, and we have a lot to offer, and we do have a lot to say about the personal injury arena. In the beginning, when we first started understanding what happened, we never really understood the complexities of an injury to the same level of what we do today, because there is a huge amount of knowledge that has come about in the last 2 to 3 decades about injuries, as well as injuries that are resulting in prolonged or chronic states that affect people for their lives. But I also want to talk to Mario specifically more as an open forum today, in terms of the things that we have seen. When it comes to personal injury, how has that affected your practice in per se in the last 2 decades?
The dynamics of personal injury is a very complex one. But what I can say, Alex, with the outcomes and assessments and the goals of personal injury, it's very simple. Number one, there is a trauma. So there's a date of injury, whether it's a mountain biking accident or a car accident, a football injury, soccer, a slip and fall. You try to put the Christmas lights on and you wipe out. All of those things, what it comes down to is this event. You have to start with the event. And that is the story, the intro to the story of recovery. And what I've noticed is that a majority of the people minimize that event because we've been trained to minimize injuries, period. We do this consistently as little kids. You're fine, wipe it off, run a lap, be a big boy. It's not a big deal. I see this with kids on playgrounds. They wipe out. I'm talking about they come off the slide, and the first thing that hits the ground is their coccyx, their backs, that is like trauma, like severe trauma. And again, it's overlooked. And those type of patterns, I would say, in my journey, my quarter of a century plus of taking care of personal injuries. And again, on another side, the word personal injuries has like a negative connotation, like, oh, this is like.
How so, Mario?
It's like most people look at it. It's like it's fake. It's not real. People are trying to make something out of nothing. They're trying to get paid. And all that. That is not appropriate at all. And those type of conversations are conversations that show what in my mind, in my view, is no care. Like, it doesn't matter. You don't matter. Your health doesn't matter. Wipe it off and quit whining about it. And you're fine. Well, it begins at an early age as kids, and it goes to adolescence in sports. I see so many personal injuries in sports, like between the ages of 7, 10, 12, 13. and they're misdiagnosed, they're undertreated, and they become very chronic. There's a chronicity, Alex, in that, and as they grow up, you have these issues that stem back. And even my patients tell me, oh, when I was 12 years old, I had this injury and I twisted my ankle or I fell off of this. And since then, I've never been the same again.
It's so important to early diagnose an issue. When we assess a person, the worst thing that can happen is someone not paying attention to a personal injury. A hip injury can latently hang around and lead to a degenerated hip 20 years later. A neck injury, a football injury could lead to literal arthritis as time goes on. It took a long time, Mario, for the Surgeon General to come up with a little sense that smoking is hazardous for your health. We had known for literally 40 years. Well, we had known about arthritis as a disorder, and recently, in the last 2 decades, the Surgeon General has come up with saying that arthritis is a disorder of biomechanical imbalance. But where did this biomechanical imbalance begin?
Right.
Typically an injury in the past, and that people did not pay attention to, an injury, a football injury, a fall, any type of thing that causes trauma that is not dealt with. We have to really assess the situation and bring some sort of protocol to the individual to allow them to heal and to allow the body to heal like it normally should. Personal injuries are very important. They have striking issues that affect the whole body dynamics, such as an ankle injury. An ankle issue will affect a knee, will affect the hip, will affect a low back, will affect the mid-back, will affect the neck. And people just don't get it. When I'm saying people, insurance carriers, how a person who fell off of a ladder and landed on a bum and hurt their low back now has shoulder issues, 6 months, a year later.
Or headaches.
Exactly.
Headaches. I mean, they're dealing with issues with chronic headaches, with dizziness, and the conversation that you and I always have on a secondary level is like, oh, this is not contributed to the injury. Okay, so they fell down and somehow their whole body fell down, but there's only one injury, and that's like the low back, and that's it. Like none of the body, and this is what's so intriguing. I laugh about it. I just go, you know what? What color is the red bus? Right. I don't know. It's pink today because we have more pink. No, you cannot have a whole body engaged in a traumatic acceleration, deceleration injury or an impact, and someone can tell us or a patient that, by the way, the only part that you have injured is your low back or your neck, and that's it. And you were mentioning right there when acceleration, deceleration, that those are terms that are used primarily for describing someone coming from a high velocity to a sudden stop. And it's a very common physics term and a very popular one in the legal realm. And I'm glad that you used it, because the thing that we're talking today is about motor vehicle accidents, and specifically auto accidents that cause injuries and leave people with problems many, many, many months later. I know you know this, and from the time that I began my practice, the most common thing after a motor vehicle accident was someone that said, and I don't have anything that hurts, right? Absolutely.
And then how long does it take before the symptoms show up, Mario? Come on.
Realistically, Alex, I would say anywhere between three to 4 weeks, sometimes even longer. I have patients that actually refuse treatment, and they tell me this. Like I had I was hit by a car from the back. That's like real common.
Right.
People nowadays are, they pay more attention to their cell phones than what's in front of them, or anywhere, distractions, right? So for whatever reason, you get hit from the back. I mean, that incident, I hear so many times. Patients come in, they're dealing with headaches, migraines, severe migraines, where they're on heavy medications. They have neck issues, chronic, and they tell me, I've never been the same, and it started 2 years ago when this happened. Well, what that event was, I got hit from the back.
Yeah.
And then they even tell me, I've never been the same again.
You've been damaged.
You know what? And they refuse, and I tell them, well, did you get any care? No, I didn't get any care because I was fine. I felt fine, and, I didn't need it.
Patients need to get evaluated after an auto accident. They do, because you never know what's going on. And sometimes the body has amazing capacities of hiding symptoms. Literally, you can have a person who comes in your office that hurts his low back and says, I only have pain in my back, in my low back. Then after a little quick assessment, we just kind of move the neck, and he goes, ow, that my neck hurts. Right. And I go, well, did it hurt before? And I go, no. And it's not that I'm stimulating. It's that the pain in the low back camouflages other areas. It's like almost like you get hit by a hammer, and all of a sudden on your toe, you suddenly don't have back pain.
That's exactly it.
The brain has the ability to kind of manipulate the symptoms, and then later, 2 days later, 2 weeks later, after the carrier has called you and said, are you okay? Then you start having a presentation of symptoms. And, you say, well, I didn't have anything on that day. You didn't want to get checked out. And suddenly you have symptoms that you didn't know about. This happens more often and more commonly when you get older. As people get older, they have these symptoms present. We've done studies. We can actually show NCBI studies where people have issues years later from a soft tissue cervical injury that lead to chronic headaches, migraines, mental disorders as a result of poor sleep. Just chronic pain is horrible when it actually affects individuals. Therefore, it's very important, and our goal today was to have kind of an open forum of should you get care, and should you get evaluated, and what kind of treatment options do we have? I mean, we'll have tons of podcasts that we can talk about the types of treatment protocols and their best of efforts. But the bottom line is we have to start with people understanding that they do need to get assessed. And it's very important that they do, because if they don't, guess what happens?
Well, Alex, let me interrupt you for a second. And Please. Let me just say this. Question number one, and I know you know the answer, and I hear it all the time, but I want you to kind of like tackle that one, as they say. Okay, number one, how many patients have you had that walk in the past 20, 30 years of your practice that say, oh, Dr. Jimenez, you know what? I've already been checked out. I went to ER, already got checked out. They did some x-rays, told me I was fine. Mm-hmm. Gave me, 800 milligrams of ibuprofen, and gave me a muscle relaxant, some Flexeril or whatever. I'm fine.
A lot, Mario.
How many times?
A lot.
Or they go to their family practitioner, right? Same conversation. You're fine. Come back in 30 days, and I ask him. And you ask him. And what else did you do? Nothing. What in your opinion, and we deal with sports injuries. We deal with like football players getting hit from the back, tackled and all of that. Those kids weigh no more than 200 pounds. Okay, we're talking about high school, not pros. A car weighs tons.
Thousands, Mario.
Thank you.
10,000 pounds traveling at 60 miles an hour is hundreds of thousands of pounds of force.
So now, how many times in your practice career have you heard, no, I already got checked out, they said I was fine?
A lot. Mario, I remember when I first met you, we had a clinical case. Remember this, the German?
Yeah.
The German.
I'm fine.
I went to Vista Hills Hospital, right? And they told me I was fine. He had a very powerful accident. The guy came in
with
briefcase,
Alex.
Two
the briefcase. How much did it weigh?
About 40 pounds each.
Yeah.
Right? And what happened is he started, he's just leaning forward, and you and I, the first protocol we do and first of all, the clinical history was that he flipped the car and he hit his head on the top of the car. So as he flipped it, they took him to the hospital, and then they took an x-ray, and sure enough, they let him go, right? Well, he said he couldn't move around, and if you remember, he was saying, I cannot move unless I have these two briefcases holding me down. And you could see that it was pulling him forward. And Mara, remember we took the X-rays and we looked at his neck. It was broken. The neck was broken.
Yeah.
The neck was broken.
And what part of it was broken?
The lower
Alex?
cervical spine, the lower cervical around the T1, which was hidden behind the shoulder on the X-ray. Right when we did we did a swim shot and we saw the neck. And I'll never forget. I go, Mario, oh geez, look at this. And he goes, and I told him, Mr. So-and-so, I forgot his name, and he goes. We told him we got to talk to you about your X-rays, and you got a broken neck. He goes, what? What? He goes, they did not tell me, right? And well, what I did is I go, this was too complex for even my own practice. My point being is that it was something that needed to be assessed. I sent him over to Dr. Thomas Alost, which is a local great surgeon locally, and I got to tell you, I think the helicopter that landed by his office, he calls me back and he goes, hey man, why'd you send that to me? And I go, well, you're the orthopedic surgeon. He goes, dude, that is beyond my abilities. He sent it over to Dr. Meisenheimer.
Yeah,
Dr.
Spinal.
The spinal. He goes, dude, he's smarter than I am.
Dr. Alost is extremity.
Yeah. And I'm going like, dude, that was crazy. We sat him down and called the helicopters to airship him to that place. My point being is that there's a lot of things that are missed many times. We have a lot of great doctors in the city that can come together and we integrate our practices with neurologists. I know you work with neurologists, pain specialists, chronic pain specialist doctors, physical medicine doctors, which we are. We need to understand that after an injury, there is trauma. Sometimes the carriers they defy you and say that's a garden of the mill injury. It's not that way, Mario. We have to really evaluate those things. Through our history, we've seen atrocities, wrongdoings that could have been avoided by a simple assessment, a simple orthopedic assessment, and a neurological evaluation with all the tools that we have in modern science today to be able to come up with a protocol to determine if there is a problem or there isn't. It seems kind of crazy that we could leave a person, a young girl who's at the age of 18, has a neck injury, and then look at her later on at 50 and she's got massive arthritis in her neck when we could have done something.
Well, and what I would say is we need to honor each patient as though they are our children or our parents.
Exactly.
If we have those standards of care, we would care more.
Exactly.
And we would do more, and we would be a little more patient and not as fast to judge or fast to tell the patient you're fine, and those traumas. I understand there's many other issues that are more pressing, and a lot of times that's the case, and we all do our best, Alex. I always tell people, everyone does their best at the time where they are, and for myself, I look at those cases, the injuries, as very, very important cases because they delineate the rest of your life. So the better you take care of that car accident, and the reason we're talking about cars is because the impact is huge. And some of these cars, you may not see the impact. And that's another conversation that I think is important because, it's a scratch, And then the older the car, this is one thing that I've noticed, the older the car, we're talking about bumpers that are made out of steel.
Yeah.
That thing is not going to bend. But I tell you what, that force will vibrate through the whole car and impact you more.
As you mentioned that, we learned in physics, plastic deformation. That's what it is, plastic. It absorbs the energy. Today's cars are designed to absorb the energies. And the old cars were harder. So that energy, it's almost like when people know, it's like imagine driving your car on no tires, no rubber. You feel the impact. When you're on an older car, pre-60s and 70s, that thing hurt, man. That thing was not a energy absorbing kind of structure. There are cars out there that absorb energies better, but what we've learned is that position, the impact, the velocity, the angles, the vectors, all come into place. And it's very important to understand the age of the individual.
Pre-existing, I mean, I can tell you, someone that's in their 20s and someone who's in their 60s, same situation, same impact, totally different care, totally different symptoms, totally different outcome. Why? Pre-existing issues, secondary morbidities, all of those things are taken into consideration. And those patients have other issues prior to, but the point that I always reflect and share with the patient, wherever you are, the particular impact escalated and amplified the problems that you had prior.
Yeah,
and this is so important to really, again, clarify. A lot of times those issues are not created, and the verbiage that's used is it's pre-existing because you have arthritis. Yeah, I understand that, but the question is, did that impact make my arthritis and the situation better or worse? I'm sorry. Let's be simple.
Is it their fault that they are 60? Is it their fault that they have arthritis? Is it their fault that they have a back prior existing issue, that they have rods in their spine from a prior situation? No, it's not. When an impact happens, it lights those things. Yeah. Whatever you have predisposed, it lights it up and it makes it worse. You're absolutely right.
Correct.
Pre-existing.
And those are conversations that need to be clarified and answered, for the patients especially, because it's not their fault. They're the ones that didn't wake up in the morning and go, you know what? Let me see if I can hit a tree today. Yeah, so I can just kind of stimulate my neck so I can move better. No. Yeah, I mean that's the point. The point is that we need to meet each patient where they are. The point is we need to meet them where they are. And if you are at that point in your life where you have high blood pressure, diabetes, I mean, we're talking about a conversation that we had a week ago was metabolic syndrome, where you have type 2 diabetes. Now, Alex, tell me in your experience, I'll let you answer this, how does a patient with diabetes differ in their recovery, the speed, the time of their recovery, with one who doesn't have diabetes?
Using that example, you can, first of all, when you have diabetes, by definition, it's the sugar imbalance issues. The body is more inflammatory. It's just basically, it cuts down to inflammation. It affects the kidneys. And if they're pre-diabetic, they may be through going metabolic disorder, where inflammation and the blood sugar issues are going haywire. Well, it's inflamed. It's a predisposed inflammatory structure, dynamic being. Now you get that person and you hit him with a shovel that weighs 100,000 pounds in the back. Right. You light up the whole body, and you've taken someone who had a kind of a silent form of inflammation, and you put that body through an inflammatory state that literally cascades to the point where the person, literally their blood sugar. How many times after that you have an accident do people just complain their blood sugar's off? Everything, their diabetes has gone haywire. They weren't the same. It took months to even just to stabilize the blood sugar.
The recovery again, as you mentioned, because of all these secondary issues.
Yes,
is much longer, and again, due to the cascade effect of an injury amplifying not only the symptoms, but amplifying and putting so much torque on the metabolic process that person is already in. They're already in a high state of inflammation. Now we just lit the whole body into the second phase of that.
Exactly.
And that's where I would really like for everyone to understand that for those cases, there needs to be a higher level of care, and many times it's a longer level. So this is not just a 1 month, we're done, thank you very much, and have a nice day. No, this is something that needs to be very well managed. The word is managed, very well cared. So this is not like a little drive-through, program, and therefore we minimize those type of secondary issues and becoming even more chronic and impacting the functional aspect of their long-term life.
You know, the word today that didn't exist 20 years ago was functional medicine. A person who's in a car accident isn't just hurt on their knee, isn't just hurt on their neck. Their whole body's gone through a slamming potentiation, or an energy field has gone through their body. It affects every organ. It affects the mind, the brain, the skull, the brain matter, the intestinal organs. It affects everything and puts everything into chaos. If someone has a susceptibility and they get hit in an auto accident, it really brings out really a lot of the disorders that were just silent. Now they're present, and we have to hit a functional approach when we assess someone. We have to evaluate how it's affected their mind. You know, when I started practicing, Mario, PTSD wasn't even, it was considered part of the DSM-3 book, but even the veterans didn't even qualify it as a diagnosis.
Correct.
It was in our tenure over the last 20 years that people understand the impact of the mind, how it gets altered in a motor vehicle accident. The mind, the way what they call cognitive dissonance, the brain has an effect as a result of an impact. And how many times do you get a patient that says, you know what, I got hit in a car accident and I'm afraid, I'm scared, I don't know what to do when I cross an intersection. They're hurting mind-wise. So not only is the mind affected, but the physiology of their whole body's affected.
Talking about mind, let me do this. This is the word that is very, very important for all of us. Concussions. Concussions.
Absolutely.
So now, after all these years, even in the game of football, after a very well documented, I watched a movie, Concussion.
Mm-hmm.
Okay, it was almost like a documentary. This is real. So from multiple impacts in football, people are getting depression. Suicide is connected with it. Anger management, addiction. Alex, addiction.
Wait a second,
is
Mario,
connection.
Mario,
Come on.
Addiction.
Tell
me a little bit about that. Let's talk about that, because this is the thing.
That's not. Oh, it's only accident. No, it's not connected. It's only just low back and neck, and let's leave it alone. No, you're exactly right. We've got to address this. We need to put it up front and direct to everyone, because let me tell you, if a football injury can cause concussions, which has a cascade effect towards depression, suicide, addiction patterns, then let me ask you this. Is it too crazy to say that maybe car accidents have a similar effect?
Oh, absolutely, Mario.
I don't know.
It's crazy. You know what? First of all, our awareness of concussion was very different, 20, 30 years ago. It was the stinger. You got a stinger.
Rub it out. Rub it out, Alex.
The leg's going the wrong way.
Yeah.
It's a stinger. Walk it off.
Yeah.
You got knocked out on their back. A stinger. We now know the complications of the inflammatory cascade as a result of a football impact. That these things affect people's brains. When they start affecting their brains, it affects their emotions. You're right. Suicide is a complication of concussion. And when people get involved in motor vehicle accidents, they many times do get subconcussive, preconcussive, and real concussive situations happening.
And are they? Okay, let's talk about this. Are they assessed? Are they addressed? Are they?
No, not all the time. No, not all the time. A good doctor, a good qualified doctor that will do an orthopedic neurological assessment along with all the other tools and canons that they use to figure out what's wrong with this person and individual. Well, like you said, when you said that individual, N equals 1, and our patient equals 1. Each person has its own dynamics. You cannot state that everyone involved in a 30-mile-an-hour impact has a 2-week injury. This is ridiculous. This is ridiculous. doctors laugh at that, but this is the standard. The DG guideline says a sprain, strain of the neck, and let's classify that. But there's different levels. There's complications. We need to make sure we diagnose properly, that we treat properly, that we put together a team of individuals supporting and wrap ourselves around this patient to give them the treatment protocols they need. This is very important because if we don't, Mario, that person 20 years from now will be affected. And we all know that if it affects an individual in their 20s and 20 years later he's 40, it has affected a whole family.
Absolutely. It affects
everybody.
Yes, it really does, Alex. I will say this from personal experience, it affects everyone because we all go through it. The rule is when one goes through it, we all go through it. Because the dynamics of that family changes immediately. The energy changes in the house.
Everything changes.
As a matter of fact, the weekly routine changes. Now we have to take mom or dad, or we have to do this, so we can't do these other things. We can't go to football practice or basketball because now we have to go to therapy and some other things. And
right.
and the other question that I want to throw out, which is very, very sensitive, like I'm gonna just throw it out at you and make sure you don't fumble this one, all right, baby? So let me tell you this. Why is it that it is so easy to get your car fixed, but not your body? Now I'm gonna just throw it to you easy. This ain't a fastball, baby. All right? Why is it that we take care of these things? We don't doubt. We don't go, nah, you know what? That's not it. That scratch was there before. Now we're not fixing your car. Why is it that it's so easy to fix material things, right? And we never we never say this car was 3 years old and 4 years old, and we're not going to pay for it. We're just going to pay like maybe half because it's already old. Why is it that cars, material things, are paid for in full recovery, right, Alex?
Yeah.
And people are not. Why is it? I'm really.
I'll answer it.
Yeah, please.
It is called ignorance, Mario. It is ignorance to the fact of what will happen to that individual. I cannot tell you that in my life I have treated a lot of patients. Some of them were actually adjusters. Yes, adjusters that basically terrorized my patients in the early 90s that stated, you don't have a problem, XYZ. Every time they'd say the person was involved in an accident, they don't have a problem. They just blanket statement they don't have no issues. And they would create literally devastation with the patient and their treatments that they needed. Guess what? I had one that I remember. Let's call her Karen. And she worked for an insurance company with a P on it. And she remembers, and I remember her voice. She had a real unique voice. And one day I had that voice in my office. And that same Karen from that insurance company P says, I was involved in an accident with my daughter. And I go, were you that Karen from that P insurance a long time ago? And she goes, yes, I was the head adjuster. And I says to her, you really created a lot of devastation for a lot of my patients, not kind of understanding what was going on with them. She goes, I never knew that an impact with such little force of 20 to 30 miles an hour could leave me and my daughter in such devastation pain. He goes, wow. I just didn't know. And I didn't know. And I go, but you continuously created havoc for these patients. And she goes, I live with that every day. I live with the bitterness of I got divorced. I had, because of the protocols that were in place. I don't know what it was, but she led me to believe that it was her job. But the bottom line was she realized then that an injury that now was a small relative that she would have brushed off and made someone feel that was worth nothing or had no value for care has now affected her life and her daughter. It affected them that they were always being treated in the office for about a good 3 to 4 months, and they appreciated it for the first time. So to answer your question, Mario, it's just ignorance to understanding. It's because we live in a culture that I don't have time to take care of my body. I don't have time to give myself the care that I do. We treat nurses. You and I treat nurses. These are the top echelon nurse practitioners, the top end. By the time they retire, they're broken. These are the people that basically took care of themselves but didn't take care of themselves. They took care of other people but not themselves.
Correct.
So the whole idea of like why, people have a tendency to believe that it'll be gone tomorrow. They still think they're 15. But once you cross 25, 30 years old, the body takes longer to heal. The body dynamics is altered. And as that happens, well, things take a much more logical approach to consider exactly what we need to do to recover a person. So as we do these things, the answer is we believe that cars, though they are more important in terms of the present to get me here and there, but they don't see the distance and how long and how it affects them when they're 70 years old and can't walk because of an old injury back in the day, right? So it's very important for us to establish norms. N equals 1. Patient, doctor equals 1. We understand, we assess, we determine what's going on with the patient. And when we do that, you and I, we really do a great service to our patients and also to their families and also for the future generation. I cannot tell you that anxiety stays with you. No. Anxiety, if you're a very anxious person and you are a very irritable person, I can ask you a question. Who's the irritable person and anxious person in your family? Well, it was my mom. And who was that behind that? It was my grandmother, right? So if we give chronic pain to an individual, have you ever seen children of an individual who has chronic pain not affect the children in some capacity? It does. So when we kind of blow off pain and that it doesn't need to be, whatever, here's a couple $100, here, take Motrin, out the door you go, take some Flexeril, risk yourself becoming addicted with certain medications because it happens. And there's a place for things, okay? So I'm not, when there's a need for medication, you and I
Absolutely.
are we're open to that. But when the consequence leads to a lifetime, and not only a lifetime, but a legacy of perpetual issues for a future generation, it was just because we didn't know, Mario. We didn't know. They didn't know the distant consequences of a trauma. I have people that, I hate to say this, but it's ridiculous, but the anxiety that is so deep embedded in some of my patients leads back to the Civil War. I mean, back to their families when they were trying to survive during the Depression, and that same mental state follows them through. Well, an auto accident can do the same. I mean, if it traumatizes them, it gives them an injury, and they can't walk around, and now their neck doesn't move, and they used to be a car mechanic, and now they don't have a job, and all of a sudden they can't bring the bacon home. What happens?
That's a very, very good point. That's a very valid point, Alex. When an event, okay, and I see this in athletes also, when an event happens to where it alters their function, because their function is their identity. You follow me?
Right.
So all of a sudden it's like here's a wrestler, an injury, he can't wrestle anymore. Here's a football player, he has to retire early. Here is a let's say a mechanic, he cannot do his job anymore. Mm-hmm. So again, in our culture, our function is our identity. Would you say that? So that's where it's so important that we honor functional medicine, function, movement.
Let me kind of mention something, because you said we are our thing that we do. In Spanish, there's a word that literally rides on insult. Eres inútil. You're not worthy of things. Inútil. If you break out the part of the word, inútil is like when someone calls someone inútil, it's like you're insulting me, like I'm not useful. Well, the word is without utility.
Right.
Without utility.
Function.
Without function. When you hurt yourself, you become inútil. So the answer to it is, when you're hurt, what's the big bravo thing? You don't want to tell people you're hurt because you don't want to be inútil, right?
That's the psychology. That's wow. I love that. I love that connection, because now Here is the 360, baby. And this is where it all comes around. Identity, function, chronicity, and this is where we disconnect. The word is disconnect.
Yes.
We disconnect. We say, no, I'm fine. How many times do you hear people say, I'm fine?
I'm fine.
I'm fine.
Busted leg. I'm fine.
And you look at them, you go, dude, you can't. You're not fine.
You're not.
I'm fine.
No, we got to check you out. We got to figure out we got to come up with a plan.
I see so many people that instead of, again, the conversation is in car accidents and all that, oh, they're amplifying it. Nah, you know what? That's very rare. Okay. You know what? The majority in a working, society, a working force like in El Paso, we work. We love, that's our identity. We don't want to stop working. I have so many people say, no, I need to go back to work. I want to. I'm tired
Mario,
of being at home.
I got to tell you, I grew up in a world where people walked around with neck braces, and we knew today we don't use those neck braces as much or belts around. You know what? People do not come to my office faking. They just don't. I mean, it doesn't happen. It's not like they're hurt. They're jacked
Absolutely.
up, and they don't. I mean, I am a very fair guy in terms of, look, this is something realistic, and as soon as we treat them, we're done with them, and be on your way and be happy. But if you're not given the opportunity, then the healing and repair process, or what we call the fibrosis of repair,
Correct.
really doesn't.
Scar tissue
doesn't allow itself to heal properly. Let alone that's the physical component. But as we were talking about, and that doesn't really understand, people don't understand, is the consequence of the emotional effect of these things.
Absolutely.
A girl gets raped. A man watches his best friend get his head blown off in a war, right? A person drops in an elevator 40 floors. They make it, they survive. Each one of these people look normal to you. They look normal. But are they different now? They have been altered. They have been changed. These things happen. And though they look present and say, there's nothing wrong with you, do you know she was raped? Do you know that he saw a friend? Do you know that he was in an accident where nobody survived? And I've seen accidents ridiculously, literally, everyone dies except one person.
Yes.
Right. One person survives. And how did that happen? Well, it just basically the forces are such that, it went a certain energy force and it took out a group of people, and some people are fine. Sometimes you have 8 or 9 people in a car and no one gets hurt and one person gets paralyzed. How does that happen?
And this is where, the statements and the examples, these are like very, very high-end statements,
Right.
Yeah. Now the majority of them, let's say the 80% of them are exactly fitting into that conversation. Because why? You look at them and they look fine. There's no contusions. There's no broken bones. There's nothing like that. So they look fine. And a lot of them, even in my practice, they come in, they're like, nah, I'm fine. It's not that bad. I just, came in because so-and-so, one of my family members told me to come in, or, I have just a little, just a little crick in my neck and, when I wake up, and that's it. So they just point one thing. By the time we evaluate, by the time we do a spinal surface EMG, electrical myelograph, I mean, this is data. This is pre and post. You look at muscle balance. You look at vectors. By the time we do that, we say, by the way, what about these areas? Oh, yeah. You know what? I do have that. And all of a sudden, after 30 minutes to 45 minutes of digging in, actually looking into it, then they say, you know what? I'm so glad that you looked into it because I didn't think it was that bad.
Mario, you and I,
that's it.
We realize that, and we're so comfortable with ourselves that we bring in other talents. We have top radiologists that work with us, top MRI specialists, CAT scans, ultrasounds, different types of
orthopedists, top neuro.
We will find the problem. We will find the problem if there is one, and we will determine, and we will be fair. And we do not want to abuse any system. But what we're trying to do is we're trying to let people know that they should get evaluated. They should be treated. They should be, if they need it, they should get it. If they don't, well, then we send them on their very way. Many of my patients that come in they're not hurt. I've many times 8 or 9 people come in and they're all in the same car, and I only treat 2 people, right? That's fine, because you only treat that which has issues, and we have to assess the problem in the proper way. And that is what many of those that have the power that be do not think that they should have those benefits performed and available for them.
And available.
That's just it's ludicrous. And when we present that stuff, you know what? You and I go to court all the time. We go in depositions. We stand up for our patients. We represent. We are their voice to bring a clinical point of view to a physiological change. And when we do that, many times people understand. And I got to tell you, when you're talking to 12 people in a jury, there is most likely 3 or 4 of those people that have been really jacked up in a car accident at one time, and they understand the consequences of prolonged injuries and the chronicity result after something like that could occur. If not them, they've seen it in their family. So today's day is not to turn our back on people. We have to assess, and that's what we plan on doing, you and I. And I think that with our expertise, we have a lot of a book to learn how to ride bicycles. But until you get on a bicycle, you will never, ever learn how to ride a bicycle. You and I have been in clinical practice literally for over 50 years combined. We have ridden the bicycle. We understand the truth. We understand the dynamics. And we are really willing to tell everybody about a issue with one of our patients. And we're proud of that. And I know that you've been very true, and I have been very true to our patients, and we call it like it is. And I look forward to talking to more about this, because it really is an area, though it's general talk right now, but we can go into any root of these for days and hours and really get into the nitty-gritty and get nasty with the science, Mario.
Yeah.
Right?
Yeah.
Because you and I, what are we going to do? We're going to expose what we do. We're going to expose the stories. And as we do that kind of stuff and tell people about that, we're going to bring awareness that has never been, at least in the forums, to develop without a timer saying you got 4 minutes to say something. It takes a long time to kind of develop an idea.
Yeah.
So,
and this word I want to also share. The word is results. Results. Okay? In all of the environments and all the places and ecosystems that I work with and I am part of, at the end of the day, it's about results, Alex. It's about results. Before and after, what are the results? Am I better? Am I stronger? Can I move better? Am I able to get back to the function that I was before? And you know what, Alex? It's called functional medicine. It's called results. It's called chiropractic. It's called integrative care. What that means is that we are a team. I am not all to everyone and to all my patients, and neither are you. And we realize and honor that it takes a village to raise a child, but also it takes many professionals to take care and give the best care and the best results to a patient in need of the results that they deserve.
And the care. N equals 1, guys. We're going to we're going to stop it there. We're going to continue these conversations. And Mario, thank you for being the voice that you have always been, because we have a lot to say about what has gone on, and we're going to try to bring out the awareness to our community and teach about what we do, and let people know what their options are, and have the results, as you said. So we'll leave it there, and God bless.